Hey everyone, it's Dr. Rick, founder of Herbal 411. There seems to be some confusion about how to use medical cannabis properly to control and possibly reverse inflammation. Since it has been legalized in certain states, there is a groundswell for people relying on medical cannabis instead of narcotics for their chronic pain. And I want to mention a couple of points that might help you in your decision-making process before we go any further. Number one is that most people understand that if you use medical cannabis, whether in vape, smoke, edible, or topical, there is a tendency to make you get high. And the high that you manifest can range from a little bit of relaxation to being fully incapacitated or paranoid. Everyone has a different response, and it depends on if you're a neophyte or just starting with the exposure. Also depends on the product you use and its vehicle, meaning does it go in through the lungs, does it go in through the digestive system, or does it go in through the skin? And finally, if you're using other prescription medicines for your diseases, there can be competition for how it's excreted through the liver. So if a medicine gets digested and goes through the liver to be detoxified, and you take medical cannabis that also goes through the liver, there might be competition between the two to get through the liver, and that can result in degradation or elimination of your product, or the opposite end, a buildup of your product, in which case it might be unpredictable, and that's why you're supposed to ask your doctor about if this information I'm giving you pertains to you. This video is only meant to be for educational purposes, so either ask your provider or you can consult me on my herbal411.com page. Just click on the link for new patient consult and I can be your doctor and give you some guidance. So now let's get into it. The previous videos that I've done on other products that are high CBD in the state of Illinois have unboxed Chill by 1906, Sour Gummies by Wana, and the old Avexia Relief at 14:1. So let's get through how to read these labels. Chill by 1906 is a ratio of 5:1. That means 5 CBDs to 1 THC. And the ratio will guide you as far as getting more CBD, but you also have to know the milligram dose. With Chill, you'll see the total amount of CBD and THC per container, and you also see the breakdown per tablet. It essentially comes up to 25 milligrams of CBD and 5 milligrams of THC. So let's go through that. CBD is non-psychoactive, so no matter how high your CBD is in your medical cannabis product, you will not get high, and you cannot get intoxicated. But the THC, which is 5 milligrams per tablet, can get you psychoactively relaxed and high if you're a newbie. But in theory, when you have CBD available and THC available, and this is higher, it usually modulates the amount of high you get from the THC. Again, everybody's reaction is different, but I would say in general, you're safe when you have more CBD than THC. When you have 1:1, the chances of you getting high, tipsy, or a little bit intoxicated are higher. The Sour Gummies and Strawberry flavor by Wana are rated as 10:1, which seems to be a lot better than 5:1. But if you look at the breakdown in milligram dose, you have 10 milligrams of CBD and 1 milligram of THC per gummy. And I have to point out that gummies have sugar or sugar substitutes, and I don't necessarily like sugar, especially if you're insulin resistant and you're trying to reverse that. But we're locked into these few products that are available at some dispensaries, and it is hit or miss. And whether you go to recreational adult use dispensaries or medical dispensaries, the card will give you an option that you won't have if you just go in as a shopper without a card. At the least, if you have the medical cannabis card, it gives you a little bit of a discount on taxes, and many of the adult places will give you a discount just to draw you in. So if you want to use these products to control your disease process, whether it's inflammation from your gut, inflammation to your skin, inflammation to your joints, or just inflammation in general, you have to be a good shopper, and you're probably going to want to use these things as supplements for the long haul. So saving money is always important. Finally, there's the old Avexia Relief 14:1 that I don't think they have anymore, but this is the one I used to go to when it first came out a couple of years ago. And the ratio of 14:1 seems like it's the biggest and best, but if you look at the milligram dose again, it's 2.5 milligrams per tablet of CBD and 0.18 milligrams per tablet of THC. So for sure, you would not get high with 0.18 milligrams, but if we're going to use it for inflammation control, 2.5 milligrams a day is a little bit iffy. When I started using this a long time ago for my fibromyalgia, as Illinois became legal with medical cannabis, I tried to get one tablet twice to 3 times a day, but it would burn through the price of this bottle. But back then, there were hardly any choices or varieties of anti-inflammatory medical cannabis products. And now finally, the new Avexia Relief at 4-to-1. In Avexia's new formulation, there are 10 milligrams of CBD and 2.5 milligrams of THC. So let's open this thing up, take a whiff, and show you how big the tablets are. These are the tablets. They're super small, kind of like the old Avexia Relief 14-to-1s. I smell a hint of marijuana, but hardly anything that you have to be worried about if you're going to work or worried about your breath. So you can see at the new formulation, this does pack a decent amount of CBD, nothing compared to the Chill by 1906. But if you check out my video on Chill, the unboxing I did, you'll notice that there's only a couple tablets in the Chill container versus 40 tablets in this container. So for success of controlling your inflammation, whether it's rheumatoid arthritis, esophagitis, Crohn's disease, ulcerative colitis, osteoarthritis, fibromyalgia, or a host of other inflammation-driven diseases, I think 10 milligrams of CBD twice a day is a decent amount of anti-inflammatory in your bloodstream. Now, a lot of people take 1 or 2 doses and they say, it didn't really help me, but you have to understand, because CBD has to accumulate, you really have to use these products for at least 3 weeks before saying yes or no, that it gives you some assistance and takes care of the pain that you're suffering from. And it's not like you're going to have joints shrink in 3 weeks. You just have to notice an improvement in your pain tolerance. So if you try one of these as a trial, do not change any other variables to truly say that your experiment with this one product has helped your life or didn't do anything at all. The caveat again is because of the 2.5 milligrams of THC, you have to be careful about using it with other medicines, especially blood thinners, or easily getting into a drowsy/overly sedated state. Again, as I said before, if your CBD is higher than your THC, the likelihood is that this cannabinoid will control this cannabinoid and you will not feel high. Which brings me to my next point, that some people are guided by their bud tenders to use inhalation products to control inflammation. And unfortunately, when you inhale vape, shatter, or smoke the leaf, you may get a sudden rise in any cannabinoid that you're inhaling, but it will also drop precipitously quick. So if you're trying to control inflammation, with inhalation products, you will never get as decent a response as edible products. And with inhalation products, because it's usually 1-to-1, the chances of you having intoxicated effects or being high are much higher than edible. Again, ask your doctor or become one of my patients and I can help guide you. If you are in the state of Illinois, I think it is worth it to get the medical cannabis card, and I'll put the link to my website down below. And for those of you who are experienced with use in the past, the medical cannabis that we used to smoke back in the 70s and 80s is much different than the newer products now, sometimes 100 times greater in strength. So you have to be careful about how to experiment and be safe with your trials of introducing this as one of your other supplements to control and reverse disease. The data in the US, especially on PubMed, is lacking because medical cannabis is still considered a Schedule I, useless, and highly addictive. But the information from the UK, from Israel, from outside the US, all points to this medicinal plant as being very helpful if used properly. So hopefully this information helps you with decision making. If you have any questions, put them in the comments section down below. And don't forget to share this with other people who are on the fence with their disease process, even terminally ill with cancer. The research from outside the US says that there's benefit to use in making life a little bit more tolerable. Thanks for watching up until this point in time. Don't forget to hit the like and subscribe button, and I'll see you at the next video.